you have no one to guide you how to prepare or how to study a very vast subject called medicine in the final prop. What are the resources that you should be basing your preparation on? You're here to learn, but that doesn't mean that you're here to waste every day, every moment of your life only on books. Hello everyone, welcome to Physics Wala MedEd. Those who don't know me, let me introduce myself first. I'm Dr. Patil. I teach medicine for students for final prof, for the NEET PG, FMG, as well as the NEET Super Speciality. And here at MedEd, we are focusing on the NEET PG, FMG, as well as final prof. Now, if you are entering into final prof and you are at loss, you have no one to guide you how to prepare or how to study a very vast subject called medicine in the final prof, I'm here to guide you. So the guidance, let us divide that into three broad headings. First, what are the resources that you should be basing your preparation on? And then how do you allocate time for the different systems in medicine? And then how do you strategize your revision? First and the most important thing is making the right choices with respect to resources, right? So let me begin with the resources first. Now, before going to the books, videos, MCQs and all, please remember your best resource for learning medicine is patient, right? So all of us are pledging today that we will not miss or unnecessarily be absent for the bedside postings. Trust me, if you are sincerely attending your bedside postings, you are going to be gifted with 2 to 5 additional marks, which you probably will never get no matter how much time you spend with the books, because the questions nowadays are becoming clinically oriented, and something that you learn in the wards would click in the examination hall and take you to the right answer. So patience are important, and all of us are going to spend the time during the bedside postings without misusing it for solving MCQs or doing some other classwork. Okay, now coming to the remaining resources, books. We all know that Harrison is the gold standard when it comes to medicine. Now, can an undergraduate student read Harrison thoroughly and complete? Well, there are students who do that, but it is not everybody's cup of tea. I'm not saying Harrison is so difficult to understand and you will not be able to finish it. What I'm trying to tell you is that medicine is not the only subject that you're studying in final prof. And remember, you're here to learn, but that doesn't mean that you're here to waste every day, every moment of your life only on books, right? You're here to make a comfortable living. Along with that, you are dedicatedly learning. So if you have to complete Harrison, then you have to forget everything else, which I wouldn't recommend. And it is not required either for an undergraduate student. Remember, even if you read everything in Harrison, you may still do some mistakes in your final prof as well as your NEET PG exam. So don't run behind this. Don't have this FOMO that I have to complete Harrison. Okay. So yes, keep in mind Harrison, especially some chapters are important, but not everything is important. So what alternatives do I suggest? Okay. Davidson's unfortunately is being neglected by students as well as examiners in the recent times, but it's a beautiful book. It is tailor made for the undergraduates requirements. So I would still suggest that as an UG student, if you're in final prof, Davidson's is a very good book. And if you want an Indian book, I would recommend API Textbook of Medicine. API Textbook of Medicine. Very beautiful, simplified language, the crisp discussion on the topics, and all the essentials that you need to know, which is there in Harrison, is kind of filtered in this textbook, right? Now, Harrison's, I would say don't read all the chapters or systems, only select few. If you ask me, sir, what do you suggest, right? I would say cardiology and neurology. The reason for that is I want all of you to not just prepare for the final prof. Final prof, you know that ultimately by reading some Q&A books or Furry, you will be able to get through it. But whatever 1 to 1.5 years time you're spending in final year, let's learn sufficient enough so that once you go to internship, you're intern ready and you are partially ready for your NEET PG exam as well, at least with respect to final prof subjects. Okay, so Harrison's, like if then examiner is asking questions primarily based on Harrison, then it is mostly going to come from cardiology, neurology, and to some extent endocrinology. Remaining questions you will be able to answer even without opening any of the pages of Harrison, as long as you have done some decent alternate resource like Davidson or API, right? So from Harrison's, I would say you can try reading cardiology, neurology, endocrinology, and whatever section of Harrison's you find it very difficult, without hesitation, skip it, because the complex investigations and their interpretations is not required for an undergraduate student. Okay. Is there any other solution instead of Harrison? I'll come to that. Okay. So this is all for your theory prep. And we all know that ultimately majority of you are not going to go with any of these books. Either you will go with the video lecture based notes, or you're going to go ahead with the question and answer format books, right? But if you have time, make it a point to read at least some chapters from standard textbooks, because reading from standard textbooks gives you an insight which either a good teacher can give you or no alternate source can give you. Like simplified notes and all may not be able to give you a good insight into the subject. Okay. Now, what should I read for the bedside? There are two things when it comes to bedside clinical medicine. Number one, examination methods and the art of history taking. And number two, like questions related to what are the most common causes for cough, what are the causes for the cough with copious sputum production, right? What are the causes for hemoptysis? What is the most common cause for hemoptysis in young? These are the kind of viva OSCE questions that figure in during the bedside discussions. So your case presentation or practical exam is over when you are doing a good history taking. You're able to demonstrate all the physical examinations without committing any major errors in the methods, and then you're able to answer the viva OSCE questions. So practical exam preparedness, let us divide into two sections. One, history taking and examination methods. Second, being able to answer the examiner's questions. So for clinical methods, which I would say includes examination methods and history taking, right, I would recommend Hutchison's or alternatively MacLeod's, but I find Hutchison's language and the presentation is way more easy to follow, especially the examination methods. So I would recommend Hutchison's, but if you find comfort with MacLeod's or Bates, you can use. But for the case presentation related questions, right, presentation and questions that examiners tend to ask, you can either follow Archit Balur or Alagappan, right? I think most of the current generation students are very comfortable with the language of Archit Balur, so you can definitely go ahead with that. Now, what other resources I can think of as an alternative? I do not want to go with the books and all. So for clinical methods, I would suggest an alternative, which is the PW MedEd, which app has a clinical corner where the history taking and examination is being described. And to cover your theory, soon we will be probably launching a live batch where we will be discussing all the topics of medicine and similarly other subjects of final prof. So either you can enroll into the live batch for the final prof, or we already have the pre-recorded lectures which are not essentially based only on Harrison, but all the recent updates that you need to know for NEET PG. And of course, getting that into your final prof answer sheet will be a great boon. So you can also watch the recorded video lectures on the PW MedEd. Okay. And do I need any other resources? Well, there are few resources. Like sometimes suddenly a topic comes up for discussion, or you get a rare case or a common case, but you've not seen it before or you've not read about it before, and you are encountering that case in the world, and now you want to have some quick knowledge about it, right? So what should I do? So there are two good resources. One of them is StatPearls. You Google StatPearls, you will get it. It's a website. Or another one is Medscape. There are more expensive paid versions, digital versions of medical information, but you don't need it, right? So I would say subscribe to StatPearls and Medscape. Like mostly you will get the free subscription where you just search the disease and you will find all the updated information. Okay. That's about your resource selection. Now, how about time allocation? Okay, I've given you a brief sketch on how you can allocate time for different systems in medicine. Remember, when I say that, I have kept in mind that you will also be allocating similar time for ob-gynae, surgery, and other final prof subjects. So, roughly speaking, if you're reading 1 to 2 hours of medicine 3 to 4 days a week, right? You should be able to complete the CNS in around 2 months' time. CVS will also require same time. These are two major systems in medicine. Okay. Apart from that, from the theory exam perspective, endocrinology is an important system for which you can allocate 3 months. For other minor systems, you can allocate 15 days each, as I've shown here. Okay. Now, once you've completed the reading, right, you also need to get into revision. So as you get into revision, I would say revise from your own resources, whichever was your primary resource. Like if you had watched the videos and you're following the printed video notes, revise from there. If you made your own handwritten notes by attending the live lectures, or you have annotated the faculty's PDF from the live lectures, revise from there. So what I would suggest is you need to do 1 to 2 rounds of revision before your final prof exam, right? But on a daily basis, right now you have plenty of time. So on a daily basis, I would also suggest that keep doing MCQs, keep the target of 30 MCQs per day. I'm not saying only medicine, whichever you're reading today, right? Today I'm not reading medicine, I'm reading OBG. From OBG to at least 30 MCQs. You can do it from custom modules or the chapter wise modules, whatever way you're comfortable, because this is a best way of having a revision towards your main revision. If you're doing MCQs, you already have retained a lot of information, so your main revision will be just like that done. But if you're only reading theory and not doing MCQs, you're not applying what you know, and you're not like, you will require a lot of effort during your main revision sessions, right? Okay. And for the answer writing, in the MedEd, we have Furray, which is available for free to all the students on YouTube, from where you can learn how to write answers. Now you know the theory, you know the critical objective points, so you may be able to even deal with some NEET PG questions. But writing an answer is altogether still an art, and if you don't develop that, you may be able to pass. You have some knowledge, you filter it somehow, and you may be able to pass. But to get those brownies points and be in the cream layer of your batch, you also need to know answer writing skills, which you can get from Furray. But please don't rely on the Furray or Q&A books right from the beginning. You may say, sir, most of my seniors are following the Q&A books and they're doing well. Remember, they are unnecessarily putting another round of effort to study the same subjects again during internship for their NEET PG. But if you study it right from the beginning, from the objective of understanding and assimilating the subject, then your effort in the internship will be very minimal. You will be able to just like do 1 or 2 revisions before your theory exam. After that, as soon as you get into internship, you can quickly finish revising final prof subjects in 2 to 3 months, and then you can get back to your first prof, second prof subjects for your NEET PG preparation. And again, towards the final leg of your internship, last 2 or 3 months before your NEET PG exam, you will be able to revisit one more round of revision to first the final prof subjects. But if you only read it to answer your final prop theory questions, then you are again going to do whole cycle of preparing all the subjects for your NEET PG during internship or maybe a drop year, right? You don't want to get into that loop. Start preparing with the objective of understanding. So Furray or Q&A books is like, they should be considered or opened up only in the final leg of your preparation, where you're starting revising and you want to know how to write the answers. Till that time, do not even touch those sources. Clear? Okay. So that's it about how to prepare for the medicine for final year. I'll see you in another such strategy video where we will discuss how to revise medicine in the final leg of your preparation.